Hello everyone, my name is Makabi Gabai and this presentation is on lung cancer. What is lung cancer? Lung cancer is caused by uncontrolled growth of malignant cells in one or both lungs and tracheobronchial tree, a result of repeated carcinogenic irritation causing increased rates of cell replication. Proliferation of abnormal cells leads to hyperplasia, dysplasia, or carcinoma in situ. Lung cancer is a leading cancer killer in both men and women in the U.S. In 1987, it surpassed breast cancer to become a leading cause of cancer deaths in women. An estimated of over 158,000 Americans are expected to die from lung cancer in 2016, accounting for approximately 27% of all cancer deaths. The number of deaths caused by lung cancer peaked in 2005, and it has since decreased by 2.3%. Tobacco smoking is by far the leading cause of lung cancer. About 80% of lung cancer deaths are caused by smoking, and many others are caused by exposure to secondhand smoke. Lung cancer in non-smokers can be caused by exposure to radon, secondhand smoke, air pollution, or other factors. Workplace exposure to asbestos, diesel exhaust, and certain other chemicals can also cause lung cancers in some people who don't smoke. Some people inherit DNA mutations from their parents that greatly increase their risk of developing certain cancers, but inherited mutations alone are not thought to cause very many lung cancers. Doctors believe smoking causes lung cancer by damaging the cells that line in the lungs. When you inhale cigarette smoke, which is full of cancer-causing substances, changes in the lung tissue begin almost immediately. At first, your body may be able to repair this damage, but with each repeated exposure, normal cells that line in your lungs are increasingly damaged. Over time, the damage causes cells to act abnormally, and eventually cancer may develop. In some cases, lung cancer may eventually travel to lymph nodes, brain, liver, adrenal gland, and bones. Metastatic lung cancer is a life-threatening condition that develops when cancer in another area of the body metastasizes or spreads to the lungs. There are many important signs and symptoms when it comes to lung cancer, such as cough that can be chronic, dry, with phlegm, or hemoptysis, whole body that can be fatigue, loss of appetite, or weakness, frequent respiratory infections, shortness of breath, or wheezing. Also common is hoarseness, swollen lymph nodes, chest or rib pain, or weight loss. There are two different types of cancer cells: NSCLC, which is non-small cell lung cancer, and SCLC, which is small cell lung cancer. NSCLC is responsible for 85 to 90% of lung cancers. One example of NSCLC is adenocarcinoma, which is a slow-growing lung cancer usually discovered in the outer area of the lung before it has a chance to spread. It occurs more often in smokers, but it has the most common form of lung cancer in non-smokers as well. SCLC accounts for the remaining 15% of lung cancers in the United States. They tend to grow more quickly than NSCLC tumors. Usually, SCLC is more responsive to chemotherapy than NSCLC. If there's a reason to think that you may have lung cancer, an oncologist can order a number of tests to look for cancerous cells and to rule out other conditions. In order to diagnose lung cancer, your doctor may recommend imaging tests, which consist of X-ray and CT scan. An X-ray image of your lungs may reveal an abnormal mass or noodle. A CT scan can reveal small lesions in your lungs that might not be detected on an X-ray. Sputum cytology is if you have a cough and are producing sputum. Looking at the sputum under a microscope can sometimes reveal the presence of lung cancer cells. A tissue sample biopsy is a sample of abnormal cells that may be removed for diagnosis. There are 4 different stages to lung cancer. Stage 1 is when cancer is limited to the lung and hasn't spread to the lymph nodes. The tumor is generally smaller than 2 inches across. At stage 2, the tumor may have grown larger than 2 inches, and cancer may also have spread to the nearby lymph nodes. At stage 3, the tumor may have grown very large and invaded other organs near the lungs. At stage 4, cancer has spread beyond the affected lung to the other lung or to distant areas of the body. This is the most critical stage. There are several different treatments when it comes to lung cancer. Usually for stage 1 and 2, surgery is required. First method of surgery is pulmonary lobectomy, which consists of surgical removal of a part of a lung. Second method is wedge resection, which is a surgical removal of a triangular piece of a tissue from a lung. Chemotherapy, thoracotomy, and radiation may be required for stage 3 and 4. Chemotherapy kills cells that are growing or multiplying too quickly. Thoracotomy is a large surgical opening in the chest that provides access to the throat, heart, and lungs. Radiation therapy is treatment that uses X-rays and other high-energy rays to kill abnormal cells. Thank you for watching my video, and I hope you enjoyed it.